This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn. During the next 2 hours, we're going to talk about a wide variety of health topics that touch each and every one of us. During hour 2, for example, we're going to talk with a holistic dentist. We'll also be spending some time during hour 2 talking about new research for women regarding cardiovascular disease. This hour, we're going to spend some time right now talking about diabetes with Dr. Jean-Louis-Selam. He is the director of the Diabetes Research Center in Southern California, and he is the editor-in-chief of the Journals Infusystems. I hope I got that right. Dr. Selam, welcome to Late Night Health.
It's a pleasure to be with you.
We want to talk about diabetes, and let's talk about diabetes in general very quickly. We know we have an epidemic of diabetes. Can much of diabetes type 2 be controlled by diet, exercise, and, cutting back on carbs and sugar?
True. We have an epidemic. The epidemic is on type 2, 30 million in the U.S., which represents roughly 10%. It was 5% a few years ago. The epidemic is less obvious on type 1 million, but it's also on the rise. And yes, about 60% of type 2 diabetes can be prevented by improved lifestyle.
Wow, 60%?
Yeah. Now, that means like a 5 to 10% weight loss, and also exercising, and why not going veggie. But definitely weight loss is the major factor.
In your own personal life, because you see this, you've been studying this for years.
Yes.
Do you exercise regularly? Don't eat chocolate cake at the end of the meal?
I have to confess I don't exercise enough, but I'm not overweight.
Ah, okay. And so you're not at risk.
No.
But what about people in France? You're obviously from France.
Yeah.
And what about the people in France versus the U.S.? You have you eat a higher fat diet, but it's a different kind of fat, generally speaking.
I don't know if it's higher fat, but it's definitely less calories. And the obesity in France is on the rise, but like everything between France and U.S., like with 20 years delay.
Oh, okay.
So we're still in the 5% diabetes, 5 to 6% in France versus 10% in the U.S. And the diet in France is is less calorie and more regular. What has surprised me a lot here is that there is no time for regular meals at the table with the family. A lot of people, even couples, even old couples, don't sit together at the same table at the same time.
That's
true.
And
that's really bad, because that means snacking all the time. And that's one of the reasons of the high calories in the U.S.
Because we sit there by ourselves eating and eating and eating and not talking.
It's not traditional enough. I mean, the meals is sort of a tradition, if not a ceremony in France. It's not anymore in the U.S.
Well, in France, of course, food is king. It's food is celebrated. We know that.
Yeah.
Right? Not here. We have Big Macs. That's our contribution.
Yeah, but that's a bit caricatural, because
of course.
I think things have improved a lot. I think there's a really very good restaurants and good wine, good coffee, and a lot of advertising now on going veggie, going vegan, and eating less fat, less meat. People know, but it's hard to change a tradition from day to day. But it's improving. It's improving even in the U.S.
In your research and in what you do, you look at new ways of treating diabetes, both type 1 and type 2.
Right.
And in doing so, you have some research and new products to share with us.
Right. There's a lot of products. It's amazing. When I was a young student, or even a young doctor, which I'm not anymore, there was only 2 oral drugs and 2 insulins. That's it. Now there is more than 20 oral drugs and more than 20 insulins to play with. And it's not always for the good, not just for the wallet, but also for the right choice. Because it's like the innumerable TV channels. The quality is at the expense of the quantity. And so, in a lot of cases, patients, instead of trying to focus on things that's important, like dieting and like losing weight, are moving from a new med to another new med that they've watched on TV, and that does not work that much better. So, having said that, there is also good news for insulin-treated patients. There is a lot of new devices like insulin pens that finally came up here in the U.S., disposable pumps that are more convenient than the traditional pumps, even glucose sensors now that are subcutaneous, and that the patient can enjoy with, especially at night, to try to identify low blood sugars while they're asleep. You see? So that's a lot. Then there's also a lot of new insulins coming on or already on the market, like longer basal insulin. Basal means that the insulins that cover the night and in between meals, that the patient takes like once a day. Now we have insulins that can cover 3 days, which means that the patient need only to inject once every 3 days.
Oh wow! But injections? I can remember my grandfather, and it was painful for him. He was older. He was in his 70s, I think, when he started giving himself insulin shots.
Yeah.
And this is all the way back, way back.
Okay.
My producer Daryl is saying way back.
Mm-hmm.
And it was painful. And of course the needles were different, and the insulin was different back then as well.
Mm-hmm.
But there are easier, non-invasive ways to administer insulin today.
Exactly.
Including Afrezza, which
exactly, yes. Afrezza is a new way to administer insulin. The problem with all those current and past insulins, even if they've improved in quality, purity, even if the needles are thinner, even there are pens instead of syringes, they're still using the skin and the fat to inject in. That means that insulin does not go directly to the bloodstream; it stays there, and that delays the action, especially for the other insulin that some diabetics need, which is the insulins that are so-called fast-acting to cover their meals, contrary to the long-acting that covers the night. Okay, so especially for those ones, the when you inject, as traditionally under the skin, it takes several minutes before it reaches the blood, and therefore it's always desynchronized from the meal.
And what about the new ones with Afrezza, which is
it's completely different because Afrezza does not use the subcutaneous tissue. It goes directly through the lung. It's a powder. Afrezza is a small device. It's a small disposable inhaler that is filled with insulin powder, cartridges. Everything is disposable, including the inhaler.
Wow!
And the patient needs just to inhale a couple of puffs of that insulin right before the meal. And the good of it is that it goes directly through the lungs, and the lungs is so vascularized, so full of blood, that the insulin is absorbed right away, compared to the fat tissue.
It still. I just want to be clear that you still believe that 60% of the people who have diabetes, if they were motivated to change their lifestyle, they wouldn't need any drugs.
Absolutely. Yeah, I'm talking all those, novelties, including that pulmonary insulin routes, are for the patient that do really need medication on the top of the diet, and there's still at least 50 to 60%, if not 100% of those patients that still need, because it's so hard to change your lifestyle. You know that.
And also, it is very hard. Also, this is also works for diabetes type 1.
Absolutely. It was for type 1, and this insulin spray is especially good for young, active, viable lifestyle type 1 patients.
Gotcha. We're going to take a timeout. When we come back, we're going to continue our conversation with Dr. Jean-Louis-Selam, the director of the Diabetes Research Center in Southern California. I'm Mark Alyn. Hey, did you know Late Night Health is now available on iTunes? Yes, you can download us and listen to us anytime you want. Just go to iTunes.com and search for Late Night Health, and you'll find us there. We have 6 months or more of our programs right there on iTunes. All right. Daryl and I and our in-studio guest, Charla Blevins, will be back in just a couple of moments. Don't go away. Late Night Health moves forward.